Good morning, dental assistants, faculty, academic deans. We see the numbers going up and everyone's getting logged in. We're going to kick it off and say Happy Dental Assistant Recognition Week to all the dental assistants across the country. To start off, I chatted with you guys last October when we are in the midst of a global pandemic and working through all the standard precautions, helping patients in our community. I got to sit down with Steve. And we talked about safety. We talked about how do you grow in this profession and the technology that is ahead of us. We are back, and I am back with 3 all-stars that are industry's leaders, but most of all, they champion the profession of a dental assistant. I'm gonna start with our very own Dr. McCann, all the way from Colorado, multi-owner doctor. Dr. McCann, can you give a brief introduction to all of our team out there?
Sure. Hi, everyone. I'm Katie McCann. I'm a dentist with Pacific Dental Services. I joined them all the way back in 2010. I can't believe it's been nearly 11 years. But I've been working with them for 11 years. I own several practices across the country. And then I also serve as clinical director of the Rocky Mountain region, New Mexico region, and Georgia region. And then I also partner in Florida as well.
Well, thank you, Dr. McCann, for being here today. All the way from NYU, Dr. Bertolami is one of our deans at NYU. I'm so thrilled to be working with an educator that champions change in curriculum because we all know we need it. You can't have the same curriculum for 10 years and be able to advance a profession. Dr. Veralami, can you introduce yourself for us?
Sure. Thank you so much, Rose. It's a pleasure to be here and to be invited to participate. So I started out at a small community college in Northern Ohio, took the associate degree there, then went to dental school at Ohio State. There, I went into oral surgery at Massachusetts General Hospital, and then ended up with a Doctor of Medical Sciences degree from Harvard. Then taught at Harvard, taught at Connecticut, became chair of oral surgery at UCLA, dean at the University of California, San Francisco, and for the past 14 years have been the dean here at NYU.
Thank you, Dr. Bartley. And then the myth, the legend, our very own Steve Thorne, CEO and founder. Steve, can you say good morning to the dental assistants and just give a brief introduction of yourself?
Great to be here. Thank you so much, Rose. It's exciting times in dentistry. And yes, I'm Steve Thorne, I'm the founder of Pacific Dental Services. So been at this in 3 weeks. I've been at this for 33 years in this profession. So I'm super proud of how far we've come, super proud of where we're at. And I'm even more excited about the future, so I can't wait to talk about that.
Well, thank you guys all. Now, for all of our attendees, we want to know where you're from. Drop into the chat what state you're in, what school. I know we have Pima, Concord, Carrington, tons of CODA-approved programs. Drop into the chat and say good morning to us. Let us know why you're here. And every 15 minutes, dental assistants, the more comments you put into the chat, we'll be using an app and giving away a pair of Fig scrubs. So keep it going in the chat, keep the comments going, and there's also a question box. Drop those questions in so we can get your questions answered today. But I want to start with, where are we currently at with the dental assisting profession? We have Dr. McCann, who works with dental assistants across the country, Dr. Bertolami, who is helping train dental students to work with us as DAs in the practice. And then Steve, who I know has 4,000 dental assistants in his organization and supporting. Dr. McCann, can we start with you and just really, what do you feel the mindset is of the profession right now with dental assistants?
Yeah, you know, the pandemic really taught us a lot. And even before the pandemic, we started to experience a massive shortage in dental assistants around the country. And so there's this great, massive opportunity for them coming into the profession to really step up and be leaders and excel. They're so valuable, and what we learned through the pandemic is they're essential, right? So dentistry was one of those careers in healthcare, or just in general, that was deemed essential. So it's a great profession to be in. It's very stable to be in. And, you know, something that I learned is I cannot operate without them. My army in my office dropped by about 50%, and I'm still working with about, 50% of my normal capacity crew. We have 3 assistants for 3 doctors, and they really they make every day exceptional. I wouldn't be able to function without them. So they just really have a huge opportunity right now to come in and crush it in the industry.
Thank you, Dr. McCann. So we heard that, we got to come in, we got to crush it. Now we go over to New York with Dr. Veralami. You guys are leading a heath, right? Is it a heath? What type of heath? And what does that stand for?
Yes, it's called high efficiency education in dentistry. It's kind of a recognition of the fact that if you look at the dental profession, it's in tremendous transition. Dentistry used to be a cottage industry, kind of a mom and pop operation where the dentist was always a man, his wife was the office manager, and maybe the receptionist, and maybe there was a dental assistant in the office, maybe there was a dental hygienist, but possibly not. All of that has changed. And so it was a very inefficient way to operate. And so the way things have moved, and an effort we're making here at NYU, is to recognize that transition in the way we educate dental students, and also in the way we become involved with dental assisting and dental hygiene as well. So the HEAT program recognizes that the dental school is very inefficient. It's slow, it's not the way dentistry is practiced, and 50% of what a dental student learns is how to go to dental school. That's not particularly useful. So what we're trying in the HEAT program is to take dental students, fourth-year dental students, put them in an office environment. The faculty member is a practitioner, and the patients belong to the faculty member. The fourth-year student works with that faculty member as a protege. The faculty member is the mentor. And then rather than switching patients from to diagnosis and treatment planning or radiology, everything is done exactly as what would happen in a general dental practice. So that means dental assisting and dental hygiene. And that is very critical in exposing our students to what is going to be required of them in actual practice. In the pilot we ran, student productivity increased 3.5-fold. And we decided that was the way we wanted to move.
No, thank you very much. Steve, hearing those comments, as the education is pivoting, changing, becoming more well-rounded, what are your thoughts there, and how is that going to impact dental assistants are in the community?
Yeah, first, I'd like to acknowledge Dr. Bertolami. Your school does an incredible job of helping dentists be successful right out of the gate.
Thank you.
PDS is known for bringing on new grads all around the country. I think we bring on the most new grads in the country, maybe the world. And your school is right up in the top few. So great work. I love hearing, I didn't know about this HEAT program. Great work, keep it up. Love hearing it, first off. So, we are in, and I want to carry off of a point he just made, is we are in this massive transition period of dentistry. And all industries go through this once in a while if they're going to be successful. And dentistry is in one of those moments. So it's a combination of the growth of group practice, the growth of technology, the growth in education, the growth in materials that are available. All of that is happening at once in dentistry. And yet, we've sort of left behind the dental assistants the last decade, where they haven't been brought along into this whole new next evolution. And what we're trying to do at PDS is bring them along and elevate the profession of being a dental assistant. I don't think it's viewed as the same as, like, say, being a nurse. Yet, why not? It's crazy. Dental assisting is such an incredible profession. You can be an incredible dental assistant, go through all the different education and get all the different licenses. Man, in some states, you can practically do most of what a dentist does as a dental assistant in some states. And if, let's say you're in dental assisting for a while, it's an incredible launching pad into an amazing industry that is on a rocket ship up right now. The next 10, 15 years, I believe in dentistry. I said I've been in it 33 years. Next 10 or 15, so maybe I'll stay till I'm 45 years in. It's going to be the best of times. It is an awesome time to get involved. And so I know we're going to talk through some things we're doing in a few minutes.
Thank you all. The idea here, we're in this incredible launching pad. This is the time you want to join this career, get into this industry. But how do you do that, right? How do you attract yourself and make yourself an attractive candidate for doctors and clinicians who want to work with you? But then on the flip side, we need clinicians to help develop us, help champion us, and help us have career growth. And ultimately, they got to retain us. We know dental assistants, we're the gems, we're the unicorns out there. And every doctor knows that. So I want to go to Dr. McCann for this one. Dr. McCann, how do you attract dental assistants to your practice, and what are you looking for in a dental assistant?
Yeah, that's a great question. So I actually was a dental assistant for 6 years before I went to dental school. So I started out, I think I was 16. My local dentist just hired me because he knew that I was interested in the field, and I just wanted to get into the office. So at first I was just the cleaning lady. I would help, deep clean all the operatories and file charts and make confirmation calls. And then over time I started doing the x-rays, and then I started assisting with procedures. So it was really cool to come in from the ground and work my way up to being a dentist. And I also feel that that gives me a different perspective when I'm working with dental assistants, because I know how difficult and demanding their job is. They really are a buffer between the patients and the scary dentist, right? So a really good dental assistant is crucial to the success of your practice and the experience of the patient. When I'm looking for dental assistants, I want someone who takes initiative and is self-generating, right? Because there's so many duties that a dental assistant has to do, from making sure that the office is stocked to assisting with procedures, making sure the doctor's day goes smoothly, and then also managing the patient experience. So I want someone that can think ahead, stay one step ahead of me, take that initiative. But I also look for someone who is also very organized and prepared. And then, having an outgoing personality is great too, because I always want someone to be able to chat with my patients and make them feel comfortable. But I also have assistants that are really quiet, that can also just give, like a tender touch to a patient that helps them feel comfortable as well. So I don't necessarily look for experience, because I'm fortunate that I'm in one of those states in Colorado where I don't even really practice dentistry. My assistants do all of the work. I just drill and they take care of everything else. So if anyone wants to move to Colorado, you can basically be a dentist in Colorado, which is pretty cool. But yeah, just what I was saying, I always want to help mentor and train them. When we bring them in, I'm not looking for experience. I'm looking more for attitude and personality. And then we have a little program that we do in our office. It's a general outline. We start them out doing small things to sterilization. And it's not that sterilization is easy, because it's not. It's critical, right? If we don't sterilize instruments correctly, we could potentially infect a patient. So I want them to master that. Then we get them into taking x-rays for new patients and recall patients. Then we get them into chairside assisting. Then we get them into CAD/CAM restorations, imaging, designing. And then finally we get them into surgery, which is my favorite procedure. So we kind of take them along the way. But I also usually put them with me, which can be kind of scary working with the owner from the get-go. But I don't believe in putting a brand new assistant with a brand new associate. It's just like a recipe for disaster. So I usually take them under my wing from the get-go, and then I can ramp them up much quicker. I expect my assistants to become EDAs, within 3 months. We get them going pretty quickly.
Dr. McCann, what I hear there is you're putting your own time in as a clinician, and you're growing them personally and professionally. To get an EDA and to expand, you also have to provide them the opportunities to study, to prepare, not only chairside with your patients, but outside. So truly, I thank you for that. And I know so many DAs on the call thank you for that. Dr. Bertolami, I have to know this from you. Working with dental students isn't the easiest thing. I have been able to work with new associates across the country and chairside assist them through numerous procedures. How do you coach, mentor, or teach really dental students to work with dental assistants, to work with us, and really leverage us to our full potential to increase what they're doing and maximize it?
Well, I think an innovative aspect of what we've introduced here at NYU is to recognize our patient base as a resource to begin with. In other words, we've a very large dental school, over 1,900 students, if you consider our postgraduate programs and our DDS programs in dental hygiene. And we realized that our patients understood what it means to get dental care, and they show up for their appointments, so they're very reliable. So the question was, could we use our patient base as a potential recruitment pool into dental assisting? So we began approaching patients to see if they might have an interest in dental assisting. What you find is that dental assisting is a much more attractive profession than whatever their previous job was. So we've been able to recruit from dental assisting, and of course the benefit there is those patients know that they're working with students because they see the strengths and the weaknesses, the challenges that involve working with students. From the student standpoint, when you have an assistant that is progressed out of the training period and is actually a fully qualified dental assistant, they will tend to know those procedures better than the dental student will. And so we tend to look at the dental assistant as kind of a teacher. And I had this personal experience when I was in dental school. We, in those days, had what was known as a DAU clinic. It was a dental auxiliary unit. And students would do everything they could to get booked into that unit. You could get so much more done. You could understand four-handed dentistry. And what you learned very quickly is that assistant knew that procedure better than you did. And it was a wonderful experience to all of a sudden have instruments materialize in your hand, or have the assistant say, no, you're done. And I thought that was a really good experience. So what the students have to understand is that, yes, the person is a dental assistant, but they actually know what's going on much better than that student who is still learning is. And of course, in this HEAT program, there's ample opportunity for role modeling so that students can see how their faculty, who are also involved in treating patients side by side, work with their dental assistants. So so far it's been very successful. We want to upscale that entire operation as we introduce students into our new Brooklyn Center. But with the dental assistants we've trained thus far, it's worked very well, and every one of them has found employment with no problem whatsoever.
Yeah.
Can I chime in real quick?
Absolutely, Dr. McCann.
Really good point about the dental assistants knowing the procedures better than the dentists, the dental students. That's so true. So because I was an assistant for 6 years, dental school was pretty easy for me. But my assistants are so well trained, especially in Colorado, because they can do all of, cementation of crowns and everything else, that I use my assistants to help monitor the clinical excellence of my clinics. So I have lead assistants that travel around to all of my offices, and they will do chart audits to let me know if the crowns are looking good, if the fillings are looking good. It's my assistants that are helping me make my associates better. So that was a great point you brought up.
Steve, what do you think about all this?
Well, I just want to comment on what Dr. McCann said. I love it in Colorado. I couldn't agree more with light. For 30 years, I've been talking about licensure expansion. I love it. Not all states are that way, though. Some states, and they're all different based on the dental board. I think some dental assistants in some states can still only hold a section. So we've got to change that. We've got to change that. And don't get me on that going. We need to have another talk here, podcast on just all the regulation in dentistry. Okay. Aside from that. So you guys both said something really, really cool. One is pragmatically, always put the well-trained assistant with the new doc to help them out, like Dr. McCann just said, and get the new dental assistant with the veteran doc to help them. Everybody wants to be successful in dentistry. And we forget that sometimes. We forget that we need to help them in those first 90 days to really ramp fast, because it's those first 90 days where the stress will come out if they're not feeling like they know what they're doing. And that's when we see the dispersion happen, and we see turnover and things like that, because it can be tough. Dental assisting is a tough job. Okay, let's make sure we acknowledge that. It is a tough job, but it's a great job. And what's really cool, I want to segue off of one of the things Dr. McCann said is how does the dental assistant provide so much value to the dental practice and to the dentist? So one of the things we teach, and I learned real early on, because I started as a dental assistant too, right after I put in the computer system. So I did the same thing as Dr. McCann. same kind of ramp up started, basically the same ramp. And we know that when the doc leaves the room, what happens in that operatory if the dental assistant will stay in that room. And the questions haven't changed in 30 years. Like if Dr. McCann was in there and I was her assistant, they'd probably turn to me and go, you know, is she really old enough to be a dentist? Okay, that happens. That's a real question. They ask another question. Do you let her do your work? They ask that all the time. They'll ask, where did she go to school? Okay. They'll ask, what would you do? Right? And it's the same questions for my 3 decades that patients ask of their dental assistant. And so the dental assistant is so critical to the financial success of that practice. And we forget that sometimes because it's all about that case acceptance that they help the dentist get by how they talk to the patient, answer the questions, and show confidence in their dentist. Okay, so that's what's so great about being a dental assistant there. And also, let's say you want to move on. Sometime you've been, like you are, Rose, the vice president of the California Dental Board. Congratulations there. And moving up in the world there and more responsibility. It's great. Some people want to do that. And my right hand in the company is Joanna Rogers, who started out as a dental assistant, by the way, years ago. I won't say what year because I don't want to age her, but it was a while ago, about the same time I started in dentistry. And now she is one of the most powerful women in all of dentistry because she's the chief administrative officer and chief people officer, I think is her title, for the organization. So overseeing about 14,000 people, approaching 15,000 people in PDS, and responsible for helping them all be successful. So she's moved up an incredibly long way over the years. As a dental assistant, I could go through all her roles. So there's all this opportunity for dental assistants today, and it's only going to get better.
So Steve, you kind of take us to a segue I really want to go into, because we know as an industry, retaining dental assistants to stay in the profession is where we need improvement, hands down. And there's a lot of layers of that. I'll throw it out there, you know, it is training and it is the opportunity for growth. It is mentorship, coaching, this career path. But I'll say it loud and proud because I am a dental assistant. The other piece of it's comp. And you know, being compensated for what we do in the practices. I would love to hear from each of you guys your thoughts on, you know, how do we retain dental assistants in the profession, and what are each of you maybe doing to help those initiatives? Dr. McCann, you want to kick us off?
Sure, absolutely. You know, one of the we believes of the organization is we compensate people based on their value to the company, right? And I think it's really important to have a frank conversation that not all people provide the same amount of value to the office, you know? And there's some people that I do see go into dental assisting that are doing it because they think it's going to be a good career, but they don't really have that innate passion to help people. And like you guys said, dental assisting is a hard job. You know, it's also, I mean, I love dentistry, so I think it's great, but it's gross, right? I mean, we're working in people's mouths with like disgusting stuff going on. So it's not for everybody. So the people that get into dental assisting that are passionate, that want to develop and become great, absolutely they need to be compensated for that. I'm known for having the highest paid dental assistants in the region that I serve because my assistants work their butts off. They provide tremendous value to my practice and we keep on developing them. So I am in alignment with that you know, organization, we believe, and I have no problem paying them what they're worth. In terms of mentoring them, I think it's important to spend the time to get to know them and understand what their goals are. I always try and help them both, you know, clinically in the profession, but then I also want to help them grow personally. So, you know, one of the goals that one of my team members had, she wanted to take her family to Disney World. So we created a financial plan, savings plan to get her to be able to take her family there. One of my other assistants, I have several assistants that transition out of assisting and go to hygiene school. I think I've had 6 in the past 2 years. So just helping them prepare for hygiene school. So no matter what their goals are, I always try and help them achieve them, whether it's dental assisting or not. But yeah, compensation is super important. And if that dental assistant is willing to work hard and can add that value to my practice, I have no problem compensating them for that.
No, thank you for that for Dr. McCann, because compensation is important to a lot of us. There's a lot of layers of it. So I really appreciate it as a dental assistant. I know my peers on this call appreciate it too. Dr. Veralami, I have a question for you. So when I met you, within like, I think 3 minutes, I told you I'm doing my PhD and I may need somebody on my team to, you know, help me when I get to my dissertation. So I put it right out there that I wanted support and would love your mentorship, your leadership. What's advice? You know, we heard that compensation comes with growth, but dental assistants need to improve clinically, but also add leadership to their wheelhouse. What is your advice on that when we're looking at dental assistants?
Well, this is a really good question. I think there are 2 aspects to it. It has to do with what Katie already mentioned. It's something internal to the person, to not allow oneself to be labeled. So for example, over the years, we've had dental assistants rise to the position of deanships in our school. We also have had dental assistants rise up to unit heads and program heads within our school. Now, that was based on a level of value added that they brought that actually transcended dental assisting, but was part of dental assisting. And as Steve mentioned, that is continuing to grow. For instance, just as an example, we're going to see, I believe, a much greater integration of dentistry with medicine. The dental curriculum is just packed. And so a lot of the programs that are aimed at integrating dentistry and medicine at the dental student level have not been that successful. And here, for instance, at NYU, we've brought what's known as Metro Community Health. It's a medical clinic, but established within the dental school. Why did we do that? Because we get patients who are diabetic, hypertensive, obese. Who's the first person that becomes known to? It becomes known to the dental assistant. And in the past, what would happen would be we would refer that patient out. They'd have to find a doctor. Half of our patients don't have a regular doctor. And then they would get a referral, but they may never come back. Once the pain is gone, they may never come back. So what we're trying to do for the interest of our students and our patients is to see the entire dental team, and most particularly the dental assistant, as someone who identifies themselves as having a commitment to the overall health of the patient and to integration into the broader medical system. So that patient now can be taken right down to our own physicians who can train that assistant and train that dental student into what they need to do to maintain the health and to be able to manage that patient. I call it the medical management of the dental patient. I think this is going to be a huge growth area for dental assisting, and I think it's going to be a great opportunity for advancement within the field. Your mention about the PhD is, I think, absolutely terrific. It's absolutely terrific. In other words, it's taking ownership from every aspect of an office and every aspect of a profession, and that ends up being rewarded. It's incentivized, it's promoted, because everybody is looking for doing the job better if they can.
I don't think I could have said it any better. Thank you. I know we want to jump in, Steve, here, especially with dental medical integration. So we have to hear from you after those comments. It's like we have to pop in. What are your thoughts there?
So I wasn't planning on talking about that, but since Doc brought it up, I will segue on that. We've obviously at PDS been a leader in what we call internally the mouth-body connection, dental medical integration. We have some integrated practices already with nurse practitioners and MDs working in the practices. in the overall dental unit and medical unit, and working together. And we're moving to Epic so we can have an integrated health record, which is so critical to getting the medical side and the dental side to talk together. They work in different languages because of the coding system problems we have currently in the United States, where dentists are the only healthcare profession that works in a different coding system. So they have a different language than all the other healthcare providers. So that's been a big blockage to the integration, but we're trying to solve that problem, and it's super exciting. So if you are interested in working with an organization that is actively going after dental medical integration, I think PDS is the leader there. So that's all. It's the only pitch I'll make there. But back to what Dr. McCann was saying on the dental assistants, the dentists, I think, have to realize that they can achieve what she was saying was highest wages, lowest wage costs. And that is beneficial to the overall practice, it's beneficial to the owner. And we can do that. So it's so much better, right, to pay 3 or 4 dental assistants a lot more money than it is to pay 5 or 6 a lot less. And sometimes we forget that. And I know Dr. McCann, obviously I know her personally, and I know she does an incredible job of that, but the whole profession can do that with the highest wages, lowest wage costs. And we've got to remember that, because dentistry is not competing just against dentistry anymore for keeping people. This was a retention question originally. We're competing against Amazon. We're competing against other tech industries where they can go and have actually a simpler job and maybe make 25 bucks an hour at, moving boxes around at Amazon. And so if we're only paying them 18 bucks an hour, that's a big, big difference. So we've got to acknowledge that. And there's no reason to underpay dental assistants in America. There is absolutely no reason. We have to help them be successful, train them, everything Dr. McCann is doing to get them there. But then the equation, the math equation, works for everybody. Now, what are we doing about it at PDS too? I'm so passionate about this area, and there is a lack of dental assistants out there going through schools. I don't believe there's a lack of people that want to become dental assistants. We're just going to pull them from other industries. We are investing $5 million over the next 3 years to help elevate the profession of dental assisting, help invest in their training and education, invest in their wages and compensation and benefits too. So at PDS, we're putting our money where our mouth is with our dental assistants in the coming 3 years. That actually kicked off 2 months ago, so 2.5 months ago. And so we're super proud of that. And I'm working directly with Rose, and we're gonna make it happen, no doubt.
No, Steve, thank you for sharing that. When we were going through the emails and I was seeing all the conversations, dental assistants, for every PDS dental assistant that's on this call, drop the mic. That's $5 million in the next 3 years, and it has already started. This is our time now to elevate our role, own our day-to-day performance, and let's go after it together. It's time to go to work. So thank you for that, Steve. Now, okay, it's time to go to work. So what is the future for our profession? Where are we going? Where are we going to take it? And where does it start with? And I want to start with Dr. Bertolami on this one, because we start with dental students. We start with new associates. We are working with them. How do you see our relationship with clinicians in the future, Dr. Bertolami, and our role in the profession as a whole?
Yes, this is a really good question. As I say, and I alluded to this a little bit earlier, that if a dental student has no experience of working with a dental assistant, then they have to be on a very steep learning curve when they graduate from dental school. And that's one of the reasons why we're trying to create graduates who I call practice ready. It was wonderful to hear these wonderful comments about our graduates, but the key is to make sure that those graduates can go into a practice and immediately hit the ground running. Now, that requires understanding the role of the dental assistant, and more than understanding it, having had some experience of working with dental assistants to increase their efficiency and the quality of care. That I think is a key component. As the entire operation kind of lifts itself up, that is to say that a dental practice that is focused on general health care, not only oral health care, then the productivity and the efficiency and the service to the patients, I think, increases tremendously. And the satisfaction for everyone, the dentist, the dental assistant, the dental hygienist, increases. I think a lot of it has to do with self-perception. And it's very hard to perceive yourself positively if the people you're working with don't see you in that light. So this is where the change, I think, has to take place. And that's what we're trying to do at this particular institution.
So you got a shout out in the chat, and I have to say it out loud, Dr. Veralami. So it says, go Dr. Bertolami, ready for both sides. Thank you for what you're doing. So thank you from the very start from the get-go for doing everything you're doing. I love all the professors, all the instructors that have impacted my journey, and to hear what you're doing at NYU makes me like want to be a part of it. Maybe I could be adjunct faculty one day once I get my PhD. I have to toss that in there.
Maybe I just add one other point very quickly. You know, another area of deficiency we've seen, I think, in dental education generally, is that dental students, and therefore dentists, often lack the confidence and the competence in managing patients with disabilities. One of the most popular areas for us to recruit dental assistants into is in our new oral health center for people with disabilities. It was a $12 million project, and it's not completely unique, but it's nearly unique in dental schools. And the dental assistant is fundamental to that operation because they end up understanding the disabled patient probably better than anybody else.
Yeah. Can I chime in there on our,
Yes.
since Doc brought it up, we have a PDS Foundation. The PDS Foundation has one of the only special needs dental clinics that's solely dedicated to people with special needs in the state of Arizona, but it is jam-packed. And I tell you, we have an awesome dentist. I think he's from NYU, and we have a partnership with NYU. It's now a residency. I didn't think of that till I was just talking. So it's a residency program for NYU. And, but the dental assistants are so key to that. And these patients come in and, you know, it can take 2-3 hours to do a prophylaxis on these patients, right? And so the patients and the training and the education around how to serve these people is so important. Anybody out there, I know I hate doing plugs, but it is it doesn't benefit PDS at all. It's a not-for-profit foundation in the state of Arizona. If you're interested in supporting that, it's really helpful because the reimbursement system, as you know, Doc, right? The reimbursement system is not there for us.
That's right.
To operate those clinics without outside funds. And so I'm sure you're stuck with the same thing our foundation is. We have to raise money for it, right?
Absolutely, exactly the same.
Yeah, it's exactly the same. So we're always out raising money for the clinic.
You know, Dr. McCann, we're here about this mindset, this shift that's needed. I hear there's a motto in your office that says, what would McCann do? I have to know more about that as a DA, and how does that play into the dynamic of retaining dental assistants?
Yeah, so like I said earlier, I like to focus on leadership, not only professional leadership, but also personal leadership, because, you know, we've seen you kind of come up through the ranks. Joanna Rogers has come up through the ranks, and there's really no limit on what people can achieve. And I truly believe that. And so I always have these, they're not my sayings, by the way, they're all, you know, incredible leadership gurus around the country, but I always plug them into my brain. I have a note on my phone if I hear a really good leadership phrase. And so when someone's always saying something, I'll always respond with one of those phrases. And so whenever there's an issue in the office, they always say, what would McCann do? But again, I can't take credit for any of those because they were given to, or I learned them from other people. But yes, what would McCann do? You know, I really hope that over time we'll see some expanded duties be allowed for dental assistants across the country. Colorado is very liberal, but like Steve said, in some states they can't do more than suction. And that's such a disservice because, you know, if COVID has taught us anything, it's the importance of mouth-body connection, right? We know that people who have unhealthy mouths have greater risk for other diseases and viruses and respond in a less favorable way to medical treatment. And so knowing that now, we have even more responsibility in the profession to help get patients healthier. And I can serve more patients if I have qualified dental assistants able to help me. And so I really hope that we can see assistants be allowed to do more procedures, sets of procedures, so that we can go and care for more people and get them healthier. Mouth-body connection is real. And like Steve said, why isn't a dental assistant equated to a nurse, right? I want to see dental assistants termed healthcare providers, not just dental assistants. It should be more than that. And we can partner with dental assistants, educate them on the mouth-body connection, and they can help us manage these patients both dentally and medically, so we can improve the health of the population out there. So I hope that's where we are going in the future. And I know that PDS and NYU and other organizations are pushing for that.
Could I add in just one other thing there, because it's so critical? Looking at the infrastructure in the profession as to how decisions are made. How decisions are made not only within education and in the corporate sector, but also at the federal level. And so this motivated just trying to address where the weaknesses have been in dentistry. We created here just this year a Center for Oral Health Policy and Management.
Really?
And it is a leadership training program. It's being headed by Richard Valakovic, who may be known to some of you. He was the executive director and president of the American Dental Education Association for many years. He's here now at NYU and he's heading that. And we're trying to encourage people throughout the organization to think about leadership. He tells a story about being invited to the White House to talk about health policy. He was the only dentist there. There was no perspective at that level to take into consider oral health policy, which is why the reimbursement rates, why payment for disabilities, the lack of involvement of dentistry in Medicare, for example, all of these things happen because dentistry was not at the table. And if you want to move dental assisting forward, if you want to move the whole dental profession forward, we have to have a cohort of leaders who are comfortable and articulate, as it's clear you are, Rose, in expressing the needs of the public as they are met by the dental profession.
No, absolutely. You know, sitting on the dental board, I'm learning that from my peers. I have to thank, Dr. Rose Olague for giving me the opportunity when he did nominate me amongst board members as the practicing dental assistant on the board. And he really believes in, like what you say, Dr. Veralami, it's all these pieces that are going to help elevate the role and giving people the opportunity when you do have that platform, but others to grow. We have a question in the queue, and I really think it's a great question to finish with. It's the number one question I get asked by dental assistants across the country. But what is the best advice you can give us? If you were to do that, what is the best advice that you could give dental assistants about elevating their profession? But if we can go round robin, Steve, start with you, and then we'll go over to Dr. McCann and finish with Dr. Bertolami.
Great. Just to finish, add on to what Dr. Bertolami was talking about on some of the efforts that are happening. I didn't know you started that program there on that institute. That's awesome. We've been working really hard with Santa Fe Group and a couple other groups to again solve some of those problems that you're trying to solve too at the health policy issue, and some things are happening. The CDC, just one little note, CDC has now put some money to it to do a study on dental medical integration, and it just happens that the only group that got asked to be on that panel is our group, PDS, and Dan Burke, my chief strategy officer, is sitting on that board. So we'll see how that works out in the coming years. So it's great to see this happening finally. It's been a long time, a lot of hard work. So to answer your question, what I would recommend is continue to ask for more. Just like you and I had this conversation when we first met. I said, how did you get to where you're at, Rose? Because we didn't know each other. And she just you said, hey, I just kept asking for more. What can I do? How can I advance? Where can I go? I've heard this from Dr. McCann and Dr. Bertolami about it's a mindset. Hey, let's not pigeonhole this concept of being a dental assistant that all you're going to do is sit there and hold a suction. No way. It's like you can elevate your game to an incredibly high level, but God gives every bird its food, but he doesn't bring it right to the nest. You got to go after it. And so that would be my recommendation.
Thank you, Steve. Dr. McCann?
I was going to say the same thing, darn it. So my big thing is always think bigger, right? So don't be stuck where you are today, think bigger, but then make it known what you're thinking as well. You know, if you wait for someone to give you that promotion, you're not going to get it. If there's something that you want, you got to make it known so that other people can help you develop. You know, everyone, I always tell my teams, try and create a team of leaders. That way you have more horsepower, right? So if you want to be that leader, make sure everybody knows around you so that we can help support you to get you there.
Thank you, Dr. McCann. And Dr. Veralami?
You know, I do a lot of teaching and have a number of regular classes. And the first question I often ask is, write down on a card anonymously what it is you love to do. What do you love to do? Whether you were paid for doing it or not, what do you love to do? And people put down things, you know, like music or hiking or cooking, whatever it may be. And then I say, can you be open to the possibility of an acquired taste? Can you learn to love something? So I think whether it's in dentistry, dental assisting, dental hygiene, cultivating a love for the field, I think is absolutely critical. And then to understand that you have to communicate that. So you start a job and you have some hourly wage, say. Okay, if you smile while you do your work, they'll pay you more. They'll pay you more. In other words, it is an expression. Jim Rohn used to say, he was a kind of a public speaker, get the job at McDonald's, fine, whatever the minimum wage is. And if you whistle while you work, they'll pay you $1 more. In other words, we have to project in a profession like ours, a health profession, that we care about people. And it's a wonderful thing. It's, you know, a win-win in the sense that if that is who you are, or if that's who you can cultivate, patients pick that up, the practitioner picks it up, referrals pick it up. It's got to come from within, and if it's not natural, then cultivate it.
Thank you guys all for your time today. And dental assistants, I have a few words for you because it's been an extraordinary year. And I want to sign off with these last few words, personally from me to every dental assistant across the organization, across the industry that I get the honor to work with. So in the midst of a global crisis, dental assistants have continuously performed beyond what is required, understanding that during these uniquely challenging times, quality performance at every job, every day, and every hour is required. Known for our resilience, stamina, and versatility, our combination of people skills, quality clinical skills, and emotional resilience has been amplified to rise to new standards in supporting our clinicians in providing access to oral health care. Through compassion, integrity, and grit, we have united in more ways than ever thought possible. True dental heroes, through and through. We have defined the odds and redefined the power of trust and leadership for our profession. And let's go to work. We will see you guys all very soon. And yes, there will be a part 3 of elevating the dental assistant profession coming your way very soon. Thank you, Steve, Dr. McCann, and Dr. Bertolami. I look forward to working with you guys in the future and elevating the dental assistant profession together. Thank you, everyone. Have a great rest of your day.